Welcome to Medicine Talk BD channel. Today we'll discuss about the Rabeprazole tablet and capsule 20 এবং 40 mg. At first, we'll know the indication of Rabeprazole 20 এবং 40 mg capsule and tablet. The indication of the Rabeprazole is number 1 gastric, number 2 ulcer, number 3 heartburn, number 4 peptic ulcer, number 5 duodenal ulcer, number 6 healing of duodenal ulcer, number 7 treatment of pathological including Zollinger-Ellison syndrome. Now we will know the dose and administration of Rabeprazole. Rabeprazole should be swallowed whole 20 or 40 mg, can be taken with or without food. Now we'll know the contradiction of Rabeprazole. Rabeprazole is contradicted in patients with known hypersensitivity to Rabeprazole or to any component of the formulation. Now we'll discuss about the side effect of Rabeprazole. Rabeprazole are generally well tolerated. The observed undesirable effects have been generally mild to moderate and transient in nature. The most common adverse events are headache, diarrhea, and nausea. The less common adverse effects are abdominal pain, anesthesia, flatulence, rash, and dry mouth, etc. Now we'll know the Rabeprazole use in pregnancy and lactation. Pregnancy category B, there are no adequate well-controlled studied in pregnant women. This drug should be used during pregnancy only if clearly needed. Now we'll know the overdose of Rabeprazole. There is no experience with large overdose with Rabeprazole. The maximum reported overdose 80 mg. That's all from now. Please subscribe my channel and stay